Hello everyone, today we are going to talk about thyroid cancer. Have you ever had swelling in the front of the neck that made it difficult to swallow and speak? Well, this could be signs of thyroid cancer. Your thyroid produces hormones that regulate your heart rate, blood pressure, body temperature, and weight. Thyroid cancer rate seems to be increasing. Several types of thyroid cancer exist. Some grow very slowly and others can be very aggressive. This video will explain to you all about thyroid cancer, its symptoms, how to diagnose it, and treatment strategy. Our role today is to answer most of your questions regarding thyroid cancer. Today we have Dr. Song, who is a leading doctor at Chung-Ang University Hospital. She is going to discuss with us everything about thyroid cancer from an experienced medical point of view. I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Good afternoon, Dr. Song.
Good afternoon.
Nice Can you please present yourself for our viewers?
Yes, hello, I'm Song Young, and I work in the Department of Surgery at Chung-Ang University. I work in endocrine surgery and operate on diseases in the thyroid and parathyroid adrenal glands.
Dr. Song, what is thyroid cancer?
Thyroid cancer is a cancer that occurs in the thyroid gland. The thyroid gland is a butterfly-shaped organ located in front of the throat's airway, which secretes thyroid hormones. Malignant cancer from various cells in the thyroid gland is called thyroid cancer.
So, what is a benign and a malignant thyroid cancer, and what's the difference between both?
Positive thyroid gland is also called thyroid nodules, and it refers to a lump in the thyroid gland that appears positive, which is not cancer. In this case, surgery may be necessary, but if the lump is not large, it is more often decided after watching. Thyroid cancer is known to progress very slowly, but like other cancers, it is a disease that metastasizes to other areas and affects patient survival. So it is a cancer that needs to be actively treated.
So does it have usually symptoms?
Thyroid cancer often does not show symptoms. However, as cancer or positive nodules grow in size, symptoms may occur when invading the airways or nerve cells around the thyroid gland. For example, if cancer or nodules invade the voice nerve, a change in voice may occur. Or if the hump is large and the esophagus is pressed, you may feel uncomfortable eating, and there may be symptoms such as discomfort in breathing as the airway is pressed.
So doctor, what are the usual causes for thyroid cancer?
Unfortunately, the clear cause of thyroid cancer has not yet been identified. Instead, thyroid cancer is more common in people who lived near the nuclear accident, for example. The Chernobyl incident and the Fukushima nuclear incident in Japan a few years ago. Also, cancer rarely occurs, but medullary thyroid cancer has a genetic cause.
For the diagnosis, how is it usually diagnosed?
Since thyroid cancer has no symptoms in most cases, these days when medical checkups or ultrasounds are common, nodules are accidentally found in the thyroid gland during the examination, so they often visit the hospital. Some people visit hospitals because they feel a little uncomfortable with their necks. In this case, they take blood tests and thyroid hormone tests. However, cancer is not diagnosed through this. The most important thing is to check the nodules through ultrasound and diagnose the cell shape through fine needle aspiration cytology.
So what are the types of thyroid cancer out there?
The most well-known thyroid cancer is thyroid papillary carcinoma. It accounts for 90% of thyroid cancer. In addition, there is cancer called follicular thyroid cancer, which is similar to thyroid papillary carcinoma, which is derived from the same cell. However, it is known that its properties are slightly different. Thirdly, medullary thyroid cancer is associated with a gene mutation. And finally, a very rare cancer called anaplastic thyroid carcinoma. This cancer is a dangerous cancer that can die within 1 to 2 years of being diagnosed with a very poor prognosis.
How is thyroid cancer treated after diagnosis?
Surgery is the most important treatment for thyroid cancer, but not all cases require surgery. These days, if thyroid cancer is detected early and cancer is still in its infancy, some patients do not undergo surgery immediately and undergo ultrasound and blood tests once every 6 months. This is called active monitoring, and if there is no significant change in cancer cells, it is sometimes only watched without special treatment. However, this is a very rare case, and the most important treatment is to undergo surgery.
What is the follow-up for thyroid cancer patients?
Most of the patients who have undergone surgery regularly visit hospitals throughout their lives and must be examined by a doctor. Immediately after surgery, visit the hospital once every 6 months and later visit once a year. Since the thyroid gland has been removed, the patient must take thyroid hormone drugs and undergo thyroid ultrasound regularly to be diagnosed with a recurrence of thyroid cancer.
Dr. Song, can you tell us more in details about treatment of thyroid cancer?
Yes. After thyroid surgery, there are several additional treatments that help prevent the thyroid from recurring. As for surgery, surgery includes surgery to remove all thyroid gland, and in the case of very early stage cancer, some patients undergo partial thyroid resection. This is a method of removing half of the thyroid gland. However, if the thyroid gland is removed, the most important thing the patient should do is take thyroid hormone drugs. If the thyroid gland is removed, thyroid hormone drugs are prescribed because thyroid hormones become insufficient. However, it is not just taken to supplement hormones. It is also taken because thyroid hormones lower the secretion of other hormones that stimulate the thyroid gland. For this reason, thyroid drugs are prescribed because keeping this thyroid-stimulating hormone low can suppress the recurrence of thyroid cancer. The second most important additional treatment is to perform radiation iodine treatment if some cells of thyroid shells that have metastasized thyroid cancer remain. The recurrence rate is lowered through radiation iodine treatment because there is a risk of recurrence of cancer here.
So what are the advantages and disadvantages of partial thyroid removal?
Recent years ago, when thyroid cancer was diagnosed, it was considered the answer to unconditionally incision of the thyroid gland. However, from 2009 to 2014, if it is possible to resect only half of the thyroid gland, many surgeries have been performed to resect only half of the thyroid gland. The advantage of this surgery is that you may not take thyroid hormone drugs for life. In addition, the recurrence or progression of thyroid cancer is so slow that many of these surgeries have been performed recently. However, despite these advantages, the disadvantages may be that the thyroid gland has not been resected. So you have to wait and see if there will be cancer in the remaining thyroid gland.
So bilateral axillobreast approach for robotic thyroidectomy. What is it exactly, this method?
There is a surgical method called BABA through both armpits and bilateral lobes. It is not only performed in robotic surgery, but is one of the surgical methods to access thyroid cancer. Traditionally, thyroid cancer surgery has been most commonly performed with an incision in the neck. However, these days, not only women but also men are reluctant to get scars on their necks, and some patients have larger scars on their necks. Therefore, since it is burdensome to leave a scar on the neck, several surgical methods have been created to compensate for this shortcoming. These days, many surgical methods include BABA surgery, surgery through one armpit, and recently, transoral surgery through oral surgery. These methods emerged to avoid scarring the neck. I usually perform BABA surgery on my patients. In the case of BABA surgery, It can be done in robotic and endoscopic methods.
같은 경우에는 로봇 수술도 할 수도 있고 내시경 수술도 할 수 있는 그런 방법이라고 볼 수 있겠습니다.
So you said you practice the BABA method, right? Is there any other surgical treatments you practice, Dr. Sung?
In my case, I usually perform BABA surgery and sometimes oral surgery. There is no particular better surgical method, and it is best for a doctor to perform the surgery in the most convenient way. I feel more comfortable with BABA surgery, so I'm implementing more of this surgical method.
What are the different techniques used for BABA?
All surgical procedures proceed almost similarly. However, BABA surgery has a great advantage of being able to see the thyroid gland in the middle, because it is performed through both armpits and both lobes. Because it approaches the center of the thyroid gland, both sides of the thyroid gland can be viewed uniformly when viewed on camera. When entering through one armpit, it is said to be similar to the view seen through BABA surgery when incision surgery is performed. Oral surgery is performed through the mouth, and the thyroid gland is close to the mouth, so the surgical process takes shorter.
So BABA can also be used for cancer recurrence?
Although it is the same for most surgeries, unlike incision surgery, BABA surgery or other surgical methods tend to be performed less frequently when cancer recurs. However, if only the thyroid gland is incised in the first operation, it is possible to remove the lymph nodes by performing BABA surgery again when cancer recurs from the lymph nodes.
What are some possible complications after the operation?
BABA surgery does not have many characteristic complications. However, because the surgical range is wider, some patients may feel the sensation of the front chest area deteriorate. However, it is not much different from other surgical methods. Also, for example, although it is not very common, skin problems may occur while undergoing surgery to approach the thyroid from armpits. However, this is a very rare case.
So after the surgery, is it necessary to keep taking thyroid medication?
If the thyroid gland is completely removed, the patient must take thyroid hormone drugs for a lifetime. Even if you have a half thyroidectomy, you often have to continue taking the medicine if the remaining thyroid gland does not function well.
Can thyroid cancer spread to other parts of the body?
Thyroid cancer also metastasizes to other organs, just like general cancer. It is very rare to metastasize, but sometimes to the lungs or bones, and more rarely to the brain.
Is it likely that it could recur after treatment?
Thyroid cancer has a very good prognosis. Although it is rare to metastasize to other organs, lymph node metastasis occurs quite often. Therefore, even after undergoing thyroid incision surgery, it is always necessary to carefully examine whether the surrounding lymphatic gland metastasis occurs. Since lymph node metastasis often occurs, reoperation is often performed due to recurrence of cancer.
Can you tell us a bit more about the stages of thyroid cancer?
Thyroid cancer is different from other cancers. The younger you get thyroid cancer, the better your prognosis. The age standard is 55 years old. In general, there are stages 1 to stage 4, and patients under the age of 55 only progress up to stage 1 and stage 2. No matter how severe the lymphatic metastasis is, when the first phase has not been metastasized to another organ, the second phase has metastasized to another organ. In other words, the survival rate of thyroid cancer is very high, so it is scarce for patients to die. In the case of older patients over age 55, if cancer metastasis occurs due to lymph nodes, the stage rises and affects their survival rate accordingly.
Okay. Dr. Sang, my last question, how or what can be done to prevent thyroid cancer?
It is the most difficult question to answer. As I answered the first question, thyroid cancer is often unknown, so I don't know how to prevent it. It is essential to living a stress-free life. Among the types of thyroid cancer, medullary thyroid cancer is caused by genetic mutations, which the thyroid may remove in advance for prevention, but this is very rare. The most common thyroid papillary carcinoma and follicular thyroid carcinoma do not have a preventive method yet, so living a stress-free life seems to be the best way to prevent thyroid cancer.
All right. Thank you, Dr. Sam.
Thank you.
Today we learned many things about thyroid cancer, and the doctor explained in details everything related to it, such as types of thyroid cancer, its symptoms, and how it can be treated. Thank you for joining us once again today at Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.